Hi everyone, my name is Jessica. I am an integrative nutritionist and thank you so much for joining me today on my presentation about nutrition, mental health, and gut health and how all three of those things feed into each other. So some key topics that we will be covering today. One, the nervous system, namely the autonomic nervous system, how that affects our digestion and our mood. Two, blood sugar regulation, how that affects our mood, the gut-brain connection, inflammation and mental health, and very importantly, we're going to discuss the importance of holistic approach. That is mainly the whole point of this presentation, showing that different therapies such as nutrition, supplementation, specific diets, while simultaneously restoring balance of the nervous system is incredibly helpful for enhancing patient-client outcomes. Let's review the autonomic nervous system. There are two arms of the autonomic nervous system, the sympathetic nervous system, known as fight or flight, and the parasympathetic nervous system, known as the rest and digest. So the sympathetic nervous system is activated under danger or under what our mind perceives. When this is activated, we have an elevation in our blood pressure. The reason why is so that we can activate our mental capacity and also our physical capacity, because our body is assuming that we're under some sort of physical threat. So that way we can think quickly to get out of our situation. We can also mobilize quickly. We could run away if we had to. So when this is activated, it suppresses our digestion and slows gut motility. Reason being is when our body perceives us to be in some sort of danger, we're going to prioritize all of our energy to mobilization and quick thinking. Digestion takes a lot of energy, so we want to deprioritize that because we don't want to spare any energy. We need to keep ourselves safe. This also releases a lot of stress hormones, adrenaline, norepinephrine, cortisol, and those stress hormones help mobilize fast energy. So when we get into a sticky situation with our sympathetic nervous system is when it is overactive or it's not seamlessly transitioning to the parasympathetic nervous system. It's very normal for us to be in a sympathetic nervous system state at some points of the day. For example, if I walk across the street and a car almost hits me, that sympathetic arm is going to be activated so I can think quickly to get out of danger. I could also move quickly to get out of danger. But once that physical threat is over, I should be moving more into a parasympathetic nervous system state. When there's an issue is when we stay in that sympathetic dominance too long. So for example, if we always feel like we're getting hit by a car, but there's no actual danger there, our sympathetic nervous system can be stimulated when we just think about something that is stressful. We can just think about a conversation we had last week that dysregulated our nervous system, that made us feel anxious, and that can create a physiological response by an increase in stress hormones, by a decrease in prioritization of our digestion, and also increases in heart rate, blood pressure, all of those types of things, which are very useful in an acute situation, but when we have that elevated in a chronic situation, it can cause a lot of negative health consequences. So the parasympathetic nervous system, this is the rest and digest. This is where we want to be most of the time. So this supports relaxation, digestion. Our digestion is prioritized when our body feels like it's safe to divert our energy to digestion, which takes a lot of energy. This is also where we do most of our recovery. So this is when our heart rate is low, our blood pressure is low, our gut secretions are working well, our motility of our gut is working well, so we're digesting our food, we're assimilating our nutrients. So that is where we want to be most of the time because we want our gut to be working properly. So this is also where the vagus nerve is activated. The vagus nerve is the communication highway between the brain and the digestive tract. We will get more into that in the next couple of slides. So just to reiterate, chronic stress puts us in that sympathetic nervous system dominance. That's where we're always feeling like a car is going to come hit us, but there's no car, right? But our body feels like we're in this constant state of danger. I like to ask my clients this to assess if they might be in a sympathetic nervous system dominant state. Imagine if you are doing something that you typically think is lovely, like walking in the park or spending time with a loved one or drawing, whatever it is that typically makes you feel good. But for whatever reason, the last couple weeks, last couple months, when you're doing that activity, you just don't feel relaxed. You feel stimulated. You feel like you're thinking about a million other different things. You feel like you don't want to be there. You just don't feel right in a situation that you usually feel really good in. So that could indicate that you could potentially be in a sympathetic nervous system dominant state. Another indicator of that, there's overstimulation and then there's also understimulation. So you're doing something that usually gives you some sort of vivacious energy, and then you're just feeling like nothing, like blah, like flatline, like you just don't have the energy, you don't have the motivation, you don't really have the drive. So typically when our nervous system is dominated acutely, we have that overstimulation. Then when the overstimulation is active chronically, then we start to have understimulation. So an example of this is the sympathetic nervous system and its relation to the HPA axis. So this diagram here shows how we make cortisol. When we are under some sort of stress, some sort of perceived stress, the brain sends a cascade of signals through this pathway where cortisol is produced. Under acute stress, we can have high cortisol circulating in our system. And then over time, if that cortisol remains high for a long enough period, our body is going to say, you know what? I have too much cortisol. I'm going to stop production. And then we can have suppression of cortisol, low cortisol, and that is due to what some people refer to as adrenal burnout, and we can just start to feel lethargic. So here's a nice way to assess your cortisol levels, is test it. So let's test our cortisol. So let's test our cortisol to see where we are, to see if it's overactive or underactive or right in that sweet spot. So my favorite assessment is a 4-point saliva test. So this is what this graph is showing here. So we have 1, 2, 3, 4 points at different times of the day. This person did a first morning cortisol probably around 6 a.m. and then slowly titrated lower throughout the day. This person is probably in some sort of adrenal fatigue, a low production of cortisol after likely a chronic time of high cortisol production. So we want to see it in this green sweet spot. We also want to see cortisol the highest in the morning and the lowest in the evening. Sometimes there's an inversion where it's very low in the morning and then it's very high at night. So clinically that would look like somebody who's having a very difficult time going to sleep. So we're stimulated at night. When they wake up, they're very tired, very, very difficult to wake up because that cortisol is so low, it doesn't have that stimulating effect that we need in the morning to get us going. You could also do a urine test. Dutch test is a really great option for that. And then what's mostly accessible to people is a serum cortisol test, which tests usually first thing in the morning because that's typically when people are getting their labs done because most labs are fasted. But it's not very accurate because it's only giving us a snapshot in time. It's showing us where we are in the morning and it's not showing us where we're going the rest of the day. And also, it's not always first morning cortisol because typically the patient, the client has been awake for a while, took a shower, maybe did some errands, who knows, before they got that test taken, which is going to affect cortisol levels. We really want to see what the person is first thing in the morning, ideally when they're at home. But again, if people don't have access to that test, doing a serum cortisol test, if it's covered by insurance, if they're getting it ran with all their labs, still gives us some useful information. The reason why it's important to know where our cortisol levels are if we are going to treat it is because you don't want to be treating low cortisol with high cortisol supplements and vice versa. So for example, If somebody has high cortisol and we give them adrenal glandulars, it could be hyperstimulating and make the problem worse. And also if somebody has low cholesterol and we were giving them GABA and lemon balm, which is very relaxing to the nervous system, it could put them in a further state of fatigue. So here's not an exhaustive list, and none of these supplement recommendations are exhaustive lists, but just suggestions or a place to start. So some things for low cortisol are things that are stimulating. Some things for high cortisol are things that are more relaxing. And then we have supplementation for high and low cortisol. And those are more adaptogenic. So adaptogens raise levels that are low a little bit higher and levels that are high a little bit lower. So adaptogens are meant to give you a nice medium ground. So ashwagandha is one of my favorite adaptogens. Also we have B vitamins, cofactors in adrenal metabolism. Then we have zinc, another cofactor, reishi mushroom, and rhodiola rhizola. Those are also some adaptogens. So rhodiola rhizola, I always let people know that it has a lot of drying effects on the body. I do find that a lot in my practice, like drying of the eyes, of the mouth, vaginal dryness. So something to be aware of when you're using that supplement. And the whole purpose of this presentation is to link emotional disturbances, nervous system disturbances with gut function, with imbalances of our stress hormone. We don't want to have tunnel vision. So there's a lot of other reasons that we can have imbalanced cortisol. So we definitely want to rule all of those out. So if we do some treatment, we do some nervous system regulation, some supplementation, some gut health healing, and we're still seeing imbalances in cortisol, you're probably going to need to refer out to endocrinology, because it could potentially be something like Cushing's syndrome or Addison's disease. So we definitely always want to rule out some sort of pathology. And then so some other reasons for high cortisol will be blood sugar imbalances, because high cortisol mobilizes glycogen, which is stored carbohydrates in the muscles. So we can definitely see those two correlated with each other, especially if it's chronic. Sleep disorders, hormonal imbalances. So we see this with perimenopause often. Gut infections and dysbiosis, which causes inflammation and toxin exposure. And then low cortisol possible causes, like we said, Addison's disease, so that would be something that endocrinology would manage. Overtraining and poor recovery, so that's kind of the same as what we were talking about, overstimulation of stress hormones for a long period of time. Then our body just stops producing as much cortisol as it needs. Post-stress burnout, the same pathway. Hypothyroidism, chronic infections like Lyme or parasites, and then also pituitary dysfunction, which would alter cortisol production. So let's define the enteric nervous system. We just talked about the autonomic nervous system, which is part of the central nervous system. The enteric nervous system works completely separately than the central nervous system, the autonomic nervous system. However, there's communication between the two. So the enteric nervous system is located in the gut, and it is a network of about 100 million neurons that is embedded in the lining of the gut, which is absolutely fascinating to me. So inside of the enteric nervous system, we have our huge network of neurons. And those neurons interact very closely with the microbiota of our gut. So basically the bacteria of our gut. And that bacteria actually produces a lot of neurotransmitters. And so those neurotransmitters serve as communication between the different neurons in our enteric nervous system. Those neurons and neurotransmitters communicate via what is called the vagus nerve, which is the nerve that connects the central nervous system down to the enteric nervous system. So our gut has a lot of neurotransmitter activity, which affects our motility of our gut. So actually the movement of digestion of food through our digestive tract. And it also communicates to our brain that helps regulate our emotions and our mood and our mental health. So the health of our gut is incredibly important to the health of our emotional world. And we'll get more into that as the presentation unfolds. But a fun fact that I really love is that 80% of our vagus nerve signaling, it travels from the gut to the brain. So think about that. So our neurotransmitter activity gets communicated via the vagus nerve to our brain, And out of all of that communication from the brain to the gut, from the gut to the brain, 80% is from the gut to the brain. So the health of our gut greatly influences our mood, our stress responses, our cognitive function, our brain fog, all of those types of things. So focusing on gut health, healing the gut when it's inflamed, when we have dysbiosis, is incredibly crucial to our emotional well-being. So let's review. The enteric nervous system is the nervous system of our gut. How does it interact with our autonomic nervous system? So remember, the autonomic nervous system has two arms, the sympathetic and the parasympathetic. When we're in that sympathetic state, it slows our digestion. It reduces gut motility, enzyme secretion, blood flow, because our body thinks we're in danger, whether we are or whether we aren't. The parasympathetic arm of our nervous system, so that's when we feel relaxed, when we feel safe, that's going to affect our enteric nervous system by stimulating digestion. So the vagus nerve activates and it enhances our gut motility, our secretion. So review, chronic stress. So to review, chronic stress leads to sympathetic nervous system dominance, which leads to a reduction in secretion and motility regulators, which decrease motility and secretion. So you see here sympathetic nervous system dominance and how this correlates to the secretion and motility regulators. This is the interaction right here of our enteric nervous system and our autonomic nervous system. So the autonomic nervous system is saying, hey, enteric nervous system. The autonomic nervous system is saying, hey, enteric nervous system, I think you need to shut down secretion and motility because I need the energy to keep myself safe. I need to prioritize my energy for these stress hormones. It's going to help mobilize me if I'm under physical threat, which maybe we are under physical threat. Maybe we actually are about to get hit by a car, or maybe we just opened a stressful email from our boss. Either way, the body doesn't really differentiate between those two situations. It's going to think that it's under physical danger, and it's going to have the same physiological response. So what is a motility or secretion modulator? Here is a list of most of them. So under acute stress, you notice here, under acute stress, a lot of these modulators, actually all of these modulators that I have listed are activated. So they're overactive. So that could look clinically like if somebody is under acute stress, they might have like a diarrhea or urgency or stomach pain or over acid gut. So the body's stimulating acid. The body is stimulating motility. So that's where we have that contraction where we feel like we have to go to the bathroom right away or have diarrhea. Now with chronic stress is when we're talking about sympathetic nervous system dominance. Dominance is key here because the sympathetic nervous system is activated and deactivated throughout the day. But when it is dominant, when we're always feeling like we're getting hit by that car, then we're going to have a dysregulation in these modulators. Typically, they're going to be shut down or be greatly reduced. So slowed motility, our gut isn't pushing the food and mixing the food with enzymes as it should be. Slowed secretion, our body isn't secreting enzymes, bile, hydrochloric acid to help break down those nutrients so that they can be assimilated. And I'm not going to go over all of these, but we see dopamine, serotonin, acetylcholine. We're going to get into those in a bit, but those are also regulators of our motility. That helps move food through our digestive tract. So when we have low functioning neurotransmitters, our digestion is going to be slowed up. We have low functioning neurotransmitters, we're also going to have fluctuations in our emotional health because of that communication from our vagus nerve, from our gut to our brain is going to be altered. Okay. So chronic stress leads to low secretion. Secretion is the process by which the cells or glands produce and release substances, like I said in the previous slide. So that's going to be like hydrochloric acid, bile, digestive enzymes, and mucus. So we see here low secretion due to chronic stress, due to an SNS dominance, increase our enzyme bile HCl production. So if we don't have that secretion material to absorb our nutrients, we're going to have lowered nutrient absorption. Then we're going to have an increase in nutrient deficiencies. And then we're going to have impaired biochemical reactions, because our biochemical reactions in our body require cofactors for each step in those reactions. And cofactors consist of vitamins and minerals. So if we have a decrease in vitamins and minerals, we're going to have kinks in the chain of our biochemical reactions. So that can lead to metabolically driven mood disorders. So for example, B12, we'll use B12. B12 requires hydrochloric acid in the stomach, and we need that to absorb our B12. If we have low secretion due to chronic stress, we're going to have low stomach acid, potentially. If we have low stomach acid chronic, it takes a while to actually develop a B12 vitamin deficiency, but it can happen. B12 is really important for emotional health, for mood, for energy production. So if we're deficient in that, those things are going to suffer. And that can be a metabolically driven mood disorder. And then when we have a metabolically driven mood disorder, that's going to create further sympathetic nervous system dominance, because we're going to be having that heightened state of alertness. We're going to be moving away from the parasympathetic, and we are going to have emotional dysregulation. Chronic stress also contributes to low gut motility. And motility is the actual movement of food and waste through the digestive tract via muscle contractions, so it's pushing the food through, and also through something called segmentation, which is mixing the food. So we have all of these digestive enzymes, hydrochloric acid, things like that, that we need to mix with the food so that those chemical reactions can take place. If it's just sitting there, like in a bucket, it's not going to do much. But if we stir the bucket, then we're going to have more chemical reactions, have more enzymatic activity to absorb those nutrients. Okay, so low motility is going to contribute to the risk of dysbiosis. Why? Because if food is just sitting in our digestive tract and not passing through appropriately, we're going to have overgrowth of bacteria that we don't want, and potentially undergrowth of bacteria that we do want. Like we had mentioned before, neurotransmitters are produced in the bacteria of our gut. So if we have dysbiosis and imbalance of bacteria, we're going to have reduced neurotransmitter function. If we have reduced neurotransmitter function, neurotransmitters are motility regulators. So it's going to further slow our motility, which can cause constipation and bloating. If we have constipation, we're not releasing our stool. That can be impaired detoxification because we're reabsorbing those toxins in our colon, and that can contribute to hormone imbalance because we poop out a lot of our hormones. So that would be a reabsorption of those hormones that we want to excrete. Toxin accumulation, further dysbiosis, and then further SNS dominance if we're having hormonal imbalances, if we're having neurotransmitter malfunction. So those neurotransmitters that are meant for our motility, if they're not there for motility, they're also not going to be there in the quantity needed to communicate with our brain for emotional wellness. So here's some supplemental support for both low secretion and low motility. You want to make sure that you're hitting both of these categories. Again, not an exhaustive list, but some suggestions. So low secretion, we want to support hydrochloric acid. We want to support enzymatic activity. Ox bile is a helpful supplement for a lot of people. And then also some stimulators like dandelion root. I also added a multivitamin because if somebody has low secretion chronically, they likely are not absorbing and assimilating their nutrients as efficiently as they could, so we're going to support them with a multivitamin. So for low motility, the movement of food throughout your digestive tract, aloe vera is really lovely for that. It gently stimulates motility and it also soothes the lining of the gut. Ginger is a great one. Fennel and aniseed, those are nice to have as teas that you can have daily. Licorice root is also really nice to have as a tea. Magnesium citrate, that's technically a laxative if you're dosing it high. It's an osmotic laxative. So that's helpful if you are in a really sticky spot with constipation, but you definitely don't want to rely on that long term. So that's just helping the stool pass, and then you want to heal the root cause of whatever the low motility, low secretion is rooted from. But magnesium citrate is helpful to just get things going. Again, don't want to rely on that long term. Slippery elm and marshmallow root, also really nice to have as a tea. So to review, low motility allows harmful bacteria to overgrow by slowing the clearance of microbes from the gut. So when we have slow transit, we're going to have fermentation, we're going to have things growing that we don't want. And that's going to create dysbiosis. Reduced secretion of stomach acid, bile, and digestive enzymes. It creates an environment where pathogenic bacteria can thrive, because a lot of those secretion materials, they kill off the things that we don't want in our gut. So that also is going to lead to dysbiosis. So how does dysbiosis disrupt the gut-brain connection? So remember that vagus nerve communicates from the gut to our brain via neurotransmitters that are produced by gut bacteria. Now we have dysbiosis, which means overgrowth of the bad bacteria, undergrowth of the good bacteria. So how's that going to affect our emotional world? By reduced neurotransmitter production. So the imbalanced microbiota, it lowers serotonin, dopamine, and GABA. And those neurotransmitters are needed for emotional wellness, so that can increase anxiety, depression, and brain fog. Having dysbiosis also increases inflammation. So overgrowth of that harmful bacteria, it can increase pro-inflammatory cytokines, which triggers inflammation in the gut, and also neuroinflammation, also whole body inflammation, which would increase stress, emotional stress, and physiological stress. So this is also going to disrupt our vagus nerve signaling by not having adequate amount of neurotransmitters. And then this can also contribute to tryptophan diversion. We'll get into this a little bit more, but tryptophan is the precursor of serotonin production in the brain, and when we don't have adequate gut microbiota to absorb that tryptophan in the small intestines, then we're not getting enough in our brain. Also, it can divert from the serotonin pathway to something called the kynurenine pathway, which is pro-inflammatory. We will review that more in a second. So let's review production of neurotransmitters in the gut. So certain gut bacteria actually synthesize those neurotransmitters like we had previously mentioned. And those interact with the enteric nervous system, and then they interact with the vagus nerve, which interacts with our autonomic one. So 90% of serotonin is produced in the gut, which is a lot, which is most of it, right? So the following microbiota, the following probiotics are required for proper serotonin production. So Bifidobacterium, Lactobacillus, Streptococcus, and Enterococcus are all required, and certain strains of those are required. I didn't get too specific about it here, but just to show you an example of why it's so important to have enough bacteria in the gut and to have a lot of diversity of bacteria in the gut, because that's 4 different probiotics that I mentioned, and beyond that, there's different strains of those probiotics that are required. So dopamine, we have 50% is produced in the gut. We need Bacillus, Lactobacillus for production of that dopamine. I'm not going to go through all of these, but GABA, which is an inhibitory neurotransmitter which helps us feel calm, that requires probiotics. Acetylcholine, norepinephrine, histamine, glutamate, and melatonin. So this is why we need diverse microbes in our gut to have healthy neurotransmitter production. So our microbiome also indirectly influences how neurotransmitters are produced in the brain. So a lot of neurotransmitters actually produced in our microbiome, but for certain neurotransmitters to be produced in the brain, we need precursors. So typically in these 3 examples, we need amino acids. Amino acids are the substructures of proteins, basically, that we get from our diet. So we eat our protein, and we have our amino acids. They get broken down by enzymes, enzymatic activity, our gut, bile, all of those things. And then it is absorbed in our small intestines. We need a healthy microbiome for proper absorption in our small intestines. So let's just take tryptophan, for example. So we eat, I don't know, some turkey or something, which has tryptophan in it. It gets absorbed. It goes in our gut. We have hydrochloric acid in our gut. and then it goes in our small intestines. We have enzymatic activity in our intestines, and we have microbe activity in our intestines. So that tryptophan can be absorbed in that small intestine. Then it's transported in the bloodstream via transport protein, and then it can cross the blood-brain barrier. So now it's in our brain. So that amino acid from the turkey that we ate was absorbed via motility, via secretion, via healthy microbiome, went up through our bloodstream into our brain, and now it's going to be produced into a neurotransmitter. So we see how gut bacteria has influence over the neurotransmitters in our brain and in our gut, not just our gut. So tryptophan is produced as serotonin. Tyrosine is another amino acid that is produced. It is a precursor to dopamine and norepinephrine in the brain. Glutamate is another amino acid we get from our diet, is produced in the brain. It's a precursor to GABA, which is that inhibitory neurotransmitter. So GABA is the thing that helps us feel calm. So we want GABA. We want healthy amounts of GABA. So just a note on selective serotonin reuptake inhibitors and gut health, because they affect our serotonin availability. So they prevent serotonin reabsorption. So you have higher levels of free serotonin in the intestines. And serotonin is a motility regulator, remember? So it affects our mental, emotional health, but it also affects motility of our gut. So just an example of how serotonin affects our motility. When you're on an SSRI, there typically is some sort of digestive consequence to that. So it could speed up or slow down motility. And it's different in everybody because everyone has such a different microbiome, such a different environment in their gut. So everyone's going to have a different experience with that. Sometimes people experience fast motility. Sometimes people experience constipation. Sometimes people experience nothing at all. Sometimes SRIs help people's gut issues. So if somebody has IBD, where they have diarrhea, irritable bowel syndrome, sometimes SRIs can help. I'm not suggesting that this should be a treatment for that. I'm not pro or against SRIs in this presentation at all, just using it as an example of how serotonin influences gut health. So I'm sure we've all heard of the term gut feelings, which is a very real thing, and it's not just psychological. It's an absolutely biological response that is involving our enteric nervous system. So our vagus nerve, neurotransmitters, and our gut microbiota, they have a lot of sensory input of our outside world. And that sensory input gives us that gut feeling, whether we feel good about something, we feel bad about something, we should keep ourselves safe, before our brain has an opportunity to make a judgment about it. So I'm sure you've heard it before, always trust your gut, and I'm a firm believer in this because sometimes when our brains attach judgment, we can get a little clouded in our intuition. So the gut is continuously processing sensory and chemical signals which influence our intuition, our decision making. So when you walk in a room and your gut's saying, I don't know if I want to be in here, listen to it. There's definitely a reason that our gut is processing that information. It's to keep us safe, to keep us aware. Our neurotransmitters are doing their job. If you have high levels of dysbiosis, this could actually influence your intuition. So it's another reason to make sure that our guts are optimized as much as possible, because it's going to help with our decision making. It's going to help with our emotions, our intuition, and making good calls, basically. So what disrupts our microbiome? A lot of stuff. Namely, I will start with antibiotics, because antibiotics, as we know, kill bacteria, and they also kill the bacteria in our gut. So when we wipe out our gut bacteria, we're going to have reduced neurotransmitter activity. And also a lot of other issues with our gut. We can have low motility, low secretion, which is an effect of having low neurotransmitter activity. So antibiotics are absolutely needed sometimes. They save lives, they do, but we want to reduce use if they're not absolutely necessary. And if we are using them, then we want to make sure that we're taking the correct steps to re-inoculate our gut with that healthy microbiota. So autoimmunity and chronic inflammation, anything that's overstimulating our immune system is going to alter our gut barrier function, and that's going to alter our microbial balance. Chronic stress, which we've gone over. Processed and high sugar diets, so foods that are hyper-processed, high sugar diets, that can cause a yeast overgrowth, which can cause imbalance in our microbiota. Toxins and environmental chemicals that can cause systemic inflammation, specifically in our gut. Poor sleep and circadian disruptions, that's going to cause an increase in stress hormones, which we went over how that affects the gut. Excess alcohol consumption. So alcohol is the big microbiome disruptor. So abstaining from alcohol or reducing alcohol is going to be very helpful for maintaining gut health. Also, over-sterilization and lack of microbial exposure. Maybe experience a little bit of this during the pandemic, but you definitely want to have exposure to different microbes in your environment. Having a pet helps, but yes. Okay. So microbiome, diet, and lifestyle support. So lots of fiber, lots of prebiotics, lots of probiotic foods. So this is going to help nourish our gut microbiota. But here's the thing. If your gut is impaired, if you have systemic inflammation, if you've had chronic stress, if you're an SNS dominant and you have low motility, low secretion, dysbiosis, fiber-rich prebiotic, probiotic foods are probably going to hurt your digestive tract. Rich foods are really helpful for our microbiome. And it is in somebody who has a pretty healthy digestive tract to start with. So if you can withstand these foods, by all means, the more the merrier. If you can't, then you need to go through a period of repairing the gut, healing the gut, reintroducing these foods, killing off any type of microbes that are in overabundance, replacing microbes that are in underabundance that we need, and healing that systemic inflammation and our gut inflammation so that our body can withstand these foods. What do I mean by conscious eating? So we don't want to check out and disassociate when we are eating our food. We really want to check in, enjoy the things that we're eating, be mindful of what we're putting in our body. Because when we're checked in, when we're associating with sensation, with the present moment, that's going to put us in a parasympathetic nervous system state. And when we're in a parasympathetic nervous system state, our body's prioritizing digestion. So I'm not saying it just out of a let's enjoy life and be relaxed standpoint. I mean, I do believe let's enjoy life and be relaxed. But from a physiological standpoint, we want to be mindful of our nervous system state before we eat our foods. Like running around, being on meetings, running to pick up your kids in a rush and eating something isn't an ideal environment for our digestion. It happens, and that's life, and we have to do that sometimes, but when you have control over it, try to make sure you're sitting down to a nice meal, you're relaxed, you are enjoying the food that you're eating. So microbiome supplement support. Again, not an exhaustive list, but some good tips to get you started. Probiotics, absolutely. Inoculate the gut with a diverse array of probiotics. And the thing with probiotics, you got to stay on top of it. You have to do it every day. It's kind of like going to the gym. You don't just go to the gym once and be like, okay, yeah, well, I'm done. We have to keep re-inoculating the gut daily with those probiotics to get the benefits. Yeast-based support, Saccharomyces boulardii, big fan of that, especially for people who have chronic diarrhea, loose stool. Really, really helpful for a lot of different things. Prebiotics, fiber, green banana flour, potato starch, those are awesome. Inulin is also really great. You can get those as powders. And postbiotics, so butyrate is a really helpful supplement, especially for people who have dysbiosis in the gut, because butyrate is a byproduct of the assimilation of your probiotics. So you kind of want to hit everything at all angles at the same time to get the best clinical outcome. So butyrate for somebody who has had digestive distress chronically can be really helpful. I added this section because I think it's helpful to mention some insurance covered tests for our patients, for our clients, because not everybody's going to have access to functional labs. So if you refer out to a gastroenterologist, of course it depends on the gastroenterologist that you're referring to, but typically if somebody's having some pretty severe gut stuff, they're going to run a lot of these panels, and you can guide your patients, your clients on which ones to ask for. So fecal occult blood test, really important, because if there is any blood, you're going to want to do some further investigation for any type of pathology. You can do ovarian parasites, pancreatic elastase, fecal calprotectin, which will differentiate between IBD and IBS inflammation, a GI pathogen PCR, so that's going to look at different bacteria, parasitic infections or viral infections. I'm not going to go through all of these, but blood tests, like basic blood tests, and you also want to test CRP and ESR for systemic inflammation. And then always give a celiac panel if people are having a difficult time with their GI tract. You can develop celiacs later on in life due to increased inflammation chronically, so you definitely want to rule that out. It's so underdiagnosed, so if you can get somebody to get that covered by insurance, it's awesome. Keep in mind that for a celiac panel, you have to be eating gluten pretty regularly, at least a couple weeks before you get that tested. Because if you don't have exposure to gluten, you're not going to have any elevation in the antibodies. But the thing is a lot of times when people are reactive to gluten, they abstain, and then they want to get a celiac panel because they figure maybe they have celiac, and then they might get a false negative, so just something to be aware of. Just note, test, don't guess, especially with people with severe GI issues. Again, we're looking at all of this through the lens of our nervous system and chronic stress, but it could be pathology, and you don't want to leave that untreated because that could be fatal, especially with severe cases, especially with blood in the stool, fecal occult blood. A lot of times when we have internal bleeding, we don't see the blood, it looks black, so black stool, we definitely want to have further investigation. Or any type of familial history of colorectal cancer, we want to investigate, send to a GI doctor. Be hyper cautious with those things. Okay, so functional test. So GI maps, GI effects, any type of stool microbiome analysis, there's all different kinds of companies that do this. These are really helpful. They're pretty comprehensive. It shows gut dysbiosis, gut bacteria, parasites, yeast, and inflammatory markers. It's helpful if it is in the budget of your client or patient. A SIBO test. SIBO test, I believe, was on the last slide too. Typically, they are covered by insurance. So if you can get that covered by insurance, that's great. But definitely to rule out any type of small intestinal bacterial overgrowth. And then organic acids, that's helpful to determine nutrient deficiencies, evaluates gut dysbiosis, and will suggest yeast overgrowth. It doesn't diagnose that, but could suggest that that's present. So what's incredibly useful are the labs, but also clinical evaluation. So some clients or patients are just not going to get labs because of low compliance, maybe budget reasons, who knows, they just don't want to go do it. So asking them what foods are triggers can give you insight. Okay, maybe this is a SIBO thing, maybe this is a low motility thing, maybe this is related to their autonomic nervous system, based on getting to know your patient, what their life looks like, what their stress levels are like. So with the clinical eval, also understanding more about their digestive situation is putting them on a very tailored elimination diet. When I say tailored, it's getting to know them, what foods are triggering to them, which foods aren't, and cutting out the triggering foods so that they can have some reprieve from those digestive symptoms. When I say tailored elimination diet, because sometimes, like if we're cutting out all high FODMAPs, that's helpful, but sometimes that's not the issue. Sometimes it's histamine foods. Sometimes it's very specific foods that don't even fit inside the box of histamine or FODMAP foods. So everybody is so incredibly different, and people get really, really confused with what they should be cutting out. So having professional guidance is incredibly useful. So, okay, we have dysbiosis. How are we going to support that dysbiosis? So first, we're going to lower whole body inflammation and also gut inflammation for a while so that our system can kind of calm down. We're also simultaneously going to support motility and secretion issues through supplementation, give support there so that we can kind of get things moving a little bit, get things secreting so that we're absorbing our nutrients a little bit better. And then we're going to use targeted antimicrobials to reduce that pathogenic overgrowth for a certain amount of time, depending on each case. Then after, we're going to reintroduce probiotics. And then lastly, we're going to restore eliminated foods. So I didn't mention this, but in the beginning, we're always going to be on an elimination diet, a targeted, individualized elimination diet. We're going to restore eliminated foods, and then based on how the patient reacts to those foods, and we'll know how successful our treatment has been. Why antimicrobials over antibiotics? Well, antimicrobials spare a lot of beneficial gut bacteria. They do kill some, so we do have to do this reinoculation. Lower risk of resistance. Natural compounds reduce the chance of bacterial resistance. Sometimes we really need antibiotics. There can be life-saving, so we don't want to take them for something like SIBO, where we can easily get rid of that with antimicrobials. We want to save that for another instance where it could be life-saving, and so we don't have resistance to those important medications. So inflammation and mental health. So when our body is inflamed systemically and when our gut is inflamed, we're going to have increased cytokines, those inflammatory signals, and that can reduce serotonin and dopamine. It can reduce it from a couple different pathways. One, by reducing microbial diversity for that absorption of those amino acids needed to produce those brain neurotransmitters. And also, when we're chronically inflamed, tryptophan goes down this green pathway, this kynurenine pathway, and it produces something called quinolinic acid, which is pro-inflammatory. It's a neuroinflammatory metabolite. We want tryptophan to go down the serotonin pathway. So we have serotonin, it makes us feel good, it makes us feel happy, it makes us feel relaxed. And then serotonin produces melatonin, which is the hormone that we need to help us fall asleep. So when our inflammation is down, our tryptophan is getting produced into serotonin and melatonin. When our inflammation is high, it's not going down that pathway. It's creating these pro-inflammatory byproducts that we don't want, that can make us have depression, anxiety, and brain fog. Up here, this undole pathway, this occurs in the intestine. So this is in the intestine, and these two pathways occur in the brain. So anti-inflammatory diets for emotional wellness. This is a very simple list here, and it's simple for a reason. Because an anti-inflammatory diet, especially for somebody who has experienced chronic emotional dysregulation, chronic gut issues, dysbiosis, low motility, low secretion, diet is going to look different for everybody. Because here you can see I have cruciferous vegetables, which for me in my practice is like one of my number one favorite superfoods. But if somebody has a lot of GI issues, those can be incredibly triggering to your gut. So what an anti-inflammatory diet for somebody when they're in the process of healing is going to look different for everybody. But let's generalize. Foods to include that are anti-inflammatory: whole foods. Whole foods. That is going to be incredibly nutrient dense. So whole foods is important to include in your diet, most of your diet. It doesn't have to be 100%. I mean, ideally it's 100%, but we don't always live in an ideal situation. That's not real life. So most of the time we're having whole foods. Antioxidant rich foods, berry, leafy greens, turmeric, dark chocolate, like not too much dark chocolate, but that's a fun one to throw in there. And just like to circle back on bioindividuality, berries, blueberries, super high in antioxidants, raspberries are high in fiber, blackberries are high FODMAP. So this is where things get complicated and bioindividuality comes into place. But to generalize, whole foods. Foods to limit or avoid. Fried foods. Fried foods contain something called advanced end glycation products, which are very pro-inflammatory, so we want to not have those in our diet or have them greatly reduced in our diet. Refined sugars and processed carbs, it's going to cause blood sugar spikes, mood crashes, potential yeast overgrowth. Artificial additives and preservatives and hyper-processed foods, so things that we kind of already know. So anti-inflammatory supplements for emotional wellness. So tackling inflammation is very important for emotional wellness. For systemic inflammation, again, not an exhaustive list, but some suggestions. I love phosphatidylcholine. Phosphatidylcholine is great because it helps the integrity of the cell. So our cells are encased in a lipid bilayer, and when our cells are nice and fluid, things that need to get out can get out, things that need to get in. When we're inflamed, sometimes there's rigidity to that cell barrier, so we're not having transport that's needed for our physiology. Omega-3s, curcumin, resveratrol, glutathione is a favorite of mine. For gut inflammation specifically, L-glutamine is an amino acid that's really helpful for repairing the lining of the gut, especially in leaky gut. Slippery elm marshmallow, we mentioned that before. Some other ones, probiotics too. So let's talk about blood sugar. So the brain is a huge consumer of glucose, the biggest consumer of glucose by weight. So it's essential for cognitive function, emotional stability, and stress resilience. When we have dysregulated glucose metabolism, it can contribute to anxiety, irritability, brain fog, fatigue, because our brain isn't getting the stuff it needs to run. So glucose instability can be a couple different reasons why you have low blood sugar. One, we're not eating appropriately throughout the day, so our blood sugar is going to drop. Two, we have dysregulation in our insulin response, so that we're having reactive hypoglycemia when our blood sugar is too high, and then we're going to have a reaction to that. On the flip side of the coin, hypoglycemia. So that's when our blood sugar is too low. When our blood sugar is too low, we release stress hormones to mobilize energy, right? So if we don't have enough glucose, our body's like, oh gosh, we don't have enough energy. So let's bring out the stress hormones to give us energy. So that's why that happens, and then that's going to increase anxiety. And then the anxiety is going to increase sympathetic nervous system dominance. And then we know what that does to our gut. So that's going to decrease our gut function. Timing. So meal timing is incredibly important because that's going to reduce incidence of having too low blood sugar, so we're not having that cascade of stress events. Upon waking, within 30 to 60 minutes, that's going to help cortisol-driven blood spikes. Every 3 to 4 hours is going to be really, really helpful. So what that looks like is pretty much just breakfast, lunch, and dinner, and a snack in between each meal. Pre-workout is a very important time to eat, 60 to 90 minutes, so you can make sure that your body has enough glucose to run off of. Post-workout, you want to replace those glycogen stores that you use during your workout, and that's going to be really helpful for emotional stability throughout the rest of the day. Because if you're depleting all those glycogen stores and you're not replacing them, you're going to have that hypoglycemia, and you're going to feel not well emotionally. You're going to be moody. You're going to probably have cravings for very simple carbohydrates, typically foods that aren't very health supportive, because your body is screaming, I need something to replace all that stuff that you use. So you want to do that pretty soon after your workout. Evening meal, about 2 to 3 hours before to bed, to give your digestion some time to have all that pass before you go to sleep. So key takeaway, eat regularly, balance your meals. We know how to do this with protein, fat, and fiber. And we also need to have carbs, so a moderate amount of carbs depending on our personal needs. Avoid long fasting periods. Especially if you're working with somebody that has emotional dysregulation. This typically doesn't work well for people. Testing blood sugar, we know how to do this, right? A fasting blood glucose level, it is helpful to know that. It's not it doesn't give us a lot of information. It's a snapshot in time. Our hemoglobin A1C is a little bit better because it reflects our 3-month average, but it's not showing what's happening to our glucose throughout the day. A CGM, that's the best, really. If you don't have diabetes, insurance isn't going to cover it. They can be kind of pricey, but it's going to show your real-time glucose patterns. But what's much more affordable is you can get a glucometer from your drugstore. It's a finger prick test, and you can test your postprandial blood glucose, but you could also test your blood glucose upon waking. You can test points during the day to see where you're titrating up, you're titrating too low. So it's just a more affordable option. So time-restricted eating. Again, I don't recommend it for people who are having emotional dysregulation issues, because if you're fasting for more than 16 hours, that's going to increase your cortisol, because if your body doesn't have those carbs, you're going to increase your stress hormone so that you can mobilize energy, you can mobilize your stored carbohydrates. And that's going to lead to sympathetic nervous system activation, which can lead to blood sugar crashes, anxiety, gut dysfunction, all kinds of stuff we don't want. Time restricted eating that's anywhere between 12 to 14 hours, it can support your metabolism. If somebody wants to do this around 12, 13 hours, I'm okay with it. Just monitor your clients, monitor your patients, because a lot of people are very interested in time restricted eating. So I just wanted to add this slide. So it could help, if your window's not too large, but it could also hurt you. So just be mindful and monitor your response. So somatic therapy for emotional and gut health. I'm going to talk about this for one slide, but this warrants its own 4-hour presentation. But somatic therapy is my favorite way to help my clients, or to refer out to clients to get help to regulate their nervous system. So soma refers to the body. Soma means body. And somatic therapy, or somatic modalities, what they do is they marry the connection between the brain and the body. So you're becoming aware of sensation. And it really is as simple as that. So becoming aware of sensation. And when you become aware of sensation, what that does for you is it automatically puts you in the present moment. Because any type of sensation that we're having right now is what is really happening right now in this present moment. That conversation that I had last week that was difficult and stressed me out, that's not happening in this present moment. That's going to put me in a sympathetic state of my nervous system. But when I'm here, I realize I'm in my office, I'm safe, I have everything I need, there's no physical threat around me, I'm tuning into my physical sensations, I'm just feeling my hands touching each other right now. Then it's putting me in that parasympathetic state of my nervous system, because it's saying, hey, you're safe, everything's okay, we're in this present moment that is safe and controlled right now. So when we experience, or we explore modalities that help us with that brain, body, sensation-driven experience, that's going to help heal our nervous system. And it's like going to the gym. You want to go day after day so that you can strengthen that muscle. My favorite way to do this for me and for some of my clients, doesn't work for everybody, but it's a body scan meditation. It's really just taking yourself in a meditative space, scanning each body part, being aware of sensation in the body, observing it non-judgmentally, and that's really helpful for putting yourself in a parasympathetic state. We know when we're in a parasympathetic state, that's going to enhance our digestion. So this all ties into gut health. We want to modulate our nervous system so that we can have a better digestive outcome. If we have a better digestive outcome, that's going to help produce a lot of neurotransmitters. It's going to help enhance our vagus nerve activity, and it's also going to further contribute to our emotional wellness. And here we have some further considerations that are also helpful for nervous system balance in addition to somatic therapy. Prioritize sleep. Gosh, sleep is so important. Prioritizing it. So, a lot of times that means just incorporating healthy sleep hygiene. So if you're not aware what that is, you could Google it. It's just making sure that you're going to bed around the same time, waking up around the same time, limiting screen exposure. All of those things is really helpful for enhancing sleep. So it is a priority. That's why it's number 1 on the list. Setting boundaries. So, if I'm working with somebody who's really set on healing their gut, who's eating all the right things, taking the supplements, really compliant, doing some body scan meditation, some somatic therapies, if they're trapped in a relationship that's really unhealthy, we'll get a little bit better, but we're not going to get where that client wants to get. So making sure that you're setting boundaries, that you're removing yourself from toxic situations, toxic work environments. Obviously easier said than done. We can't just leave our job if it's toxic, but at least conscientiously making a plan to maybe in the future remove yourself from those situations that are really detrimental to our health. engaging in healthy activities, movement, nature, doing things that you like, things that make you feel good. Surrounding yourself with supportive people. This is so, so important. Making sure that you're around people who respect you, who think you're great, who support you. And if you aren't around a lot of people like that, making it a priority to build that community, starting from scratch. Starting from scratch it's a place to start, you know, and you can definitely find people that are supportive, that have a community feel. Would be amazing. Having fun. You know, that's what we're here for, right? That's what life is about. I mean, life isn't all about having fun, but life is about enjoying. And we do all of these things. We heal our gut. We work on our nervous system. We take the supplements. We do the elimination diet so that our body is a strong vessel to enjoy. Because when our body is not working properly, it's really difficult to enjoy life sometimes. So we do all of these things to enjoy at the end of the day, to spend time with loved ones, to have beautiful experiences, to have fun. Keep moving. I think I mentioned it before, but physical activity, having a regular exercise routine is good for everything. So do it. Keep learning. Learning builds new neural pathways and sharpens the brain. So that's really helpful for the nervous system as well. And then lastly, but definitely very important, limit screen time and limit news exposure. We weren't meant to be hooked up to a 24-hour news cycle. There's a lot of horrible things happening in the world all the time. We don't need to be privy to it all throughout our day, because that is going to be very stimulating to our sympathetic nervous system. We know what that does to us. We know now what being in a sympathetic nervous system dominant state does for our health. So we definitely need to check out, put our phones down, put our news apps on silent, take Instagram, TikTok, whatever it is off of your phone for a time being, and not be so connected to that. So that's all, everyone. Thank you. Thank you so much for listening to me talk about this. If anybody has any comments or questions, please reach out. I'd love to hear from you. I love meeting people who are interested in these things, because I'm so fascinated by how our gut works, how our brain works, how our emotions, the food we eat, the people we keep around us, all of those things are so closely tied in together. Again, I'm going to say it. We do all these things to keep healthy so that we have a vessel to enjoy, to make life beautiful. And I hope that everybody has a wonderful rest of your day. Thank you.